Good evening, everybody. In today's lecture, let us try to learn about colorectal cancer. Everybody, see, in gastrointestinal tract, our gastrointestinal tract mainly starts from the buccal cavity here, okay, and we have nasal cavity here. Buccal cavity, nasal cavity, both will open here at pharynx. We have pharynx here, and through pharynx and larynx here, this will connect to esophagus. Okay, just don't consider this. We have nasal cavity and buccal cavity. Okay, especially buccal cavity, and from buccal cavity here we have pharynx, we have pharyngeal muscles. These pharyngeal muscles will help for the swallowing of the solid particles or saliva or food particles from the buccal cavity into the esophagus. Okay, so this is esophagus, and from esophagus directly the food items or the gastric, whatever we eat or whatever we drink, that enters into the stomach, right? And from the stomach here we have duodenum. In the duodenum, the pancreatic as well as the bile secretions and pancreatic secretions both will open, and they will open into duodenum. So in the GI, in the stomach particularly, in the stomach the food particles will be mixed with some gastric secretions as well as HCl, okay, acid secretions, and mainly from the duodenum the bile secretions and pancreatic secretions. Bile and pancreatic secretions are very important enzymes which will help in digestion. So in the duodenum, the pancreatic and bile secretions will open, and they will enter into small intestines. From the small intestine, you can see here, small intestine at the end. Small intestine is uh, entering into large intestine. The area where small intestine attaches to the large intestine, that area is called cecum. Okay, cecum. And here we have, ये क्या हो गया? क्या हो गया भाई? Okay. So here we have a vestigial organ. The name of this vestigial organ is appendix. This organ has no role in our body. Anyways, this vestigial organ, sometimes it will accumulate certain food particles and it will cause inflammation, and that will cause appendicitis, and which is another very complicated stage. And in that cases we need to do appendectomy. Okay, we have to remove the appendix. In some cases, if appendix is not removed, it will be ruptured, and it will again cause complications, and it will cause severe gastric related, peritoneal related infections. And okay, wo sab cheeze we'll discuss some other time. So see, what I want you to tell is, we have colorectal cancer. What is colorectal? What is colon and what is rectum? The combination of colon and rectum the combination of colon and rectum. If cancer occurs in these both the areas, that type of cancers are called colorectal cancer. Now, what is colon and what is rectum? See, this colon and rectum, these both are the parts of large intestine. Large intestine. Okay. Colorectum, colon and rectum are the parts of large intestine. You have to remember. So see here, this region, the region where small intestine is ending, that part is called ileum. Ileum. Ileum, and this ileum is entering into colon. Colon is the large intestine. Always remember, this is colon starting from ileum. Ileum is ending at cecum, right? Cecum is the part of colon. Okay, cecum is the initial part of colon. So these all from here, this total part, this is large intestine. Total large intestine is till here. This total large intestine is colon. So what is colon? Colon is the large intestine. Major part of large intestine is called colon. So in colon we have certain parts. In colon we have 6 parts actually. In colon we have 6 parts. In that, the first part is cecum. You can see here. Cecum. Cecum is here. You can see in the image. This is cecum. Cecum is the area where ileum is attaching. Ileum is the ending part of, or the last part of small intestine. Okay, it is entering into ileum. It is entering into cecum. So cecum is the initial part of large intestine. And next we have ascending colon. You can see the colon is ascending upwards. This is called ascending colon. AC, ascending colon. And always remember, this ascending colon is present backwards. It is not present in the front side. In the abdominal side, it is located in the retroperitoneal region. It is called, see, we have retroperitoneal region. and we have intraperitoneal. You know what is peritoneal cavity? This total area is called peritoneal cavity. This total area is called peritoneal cavity. Total abdominal area is peritoneal cavity. In peritoneal cavity, we have peritoneum, one layer. The layer out of the layer, see inside. How can I tell you? See, just imagine in the abdomen. This is the total abdominal cavity, right, or peritoneal cavity. In peritoneal cavity, if you see in the front side is always it is front side is called ventral, and back side is dorsal. See, in the in the ventral part of the abdomen, we have in this the total abdominal cavity is surrounded by one membrane which is called peritoneal membrane. Okay, the organs which are present inside the peritoneal membrane are called intraperitoneal organs, and the organs which are present outside the peritoneal cavity, especially in the dorsal area, backwards, in the dorsal area backwards. Just imagine this is back and this is front. Okay, in the backwards, below the, I mean behind the peritoneal cavity, we have kidneys. Here we have kidneys. Okay, so behind the peritoneal cavity, what are all organs are there? Those organs are called retroperitoneal organs. Okay, now you see, just this is not important for us, just for understanding I'm trying to tell you. This ascending colon, this colon is called ascending colon. This colon is called ascending colon. Ascending colon is present backwards. Backwards means it is present in retroperitoneal region. It is present back behind the retroperitoneal cavity. That you have to understand. And again, this ascending colon is again entering. It is attaching to the transverse colon. This is called transverse colon. This transverse colon, from the back it comes frontwards. It comes in the front, in the abdominal cavity. Just behind the, just below the, we have what we have, we can say, yeah, here we have stomach, right? Here we have stomach. Just below the stomach we have transverse colon. This is transverse colon, and again this transverse colon will enter into descending colon. This descending colon again goes back. This descending colon again goes back. So now what I want to tell is, the ascending colon and descending colon, ascending and descending colon, both are retroperitoneal organs. They are present in retroperitoneal region. Okay, and here the transverse colon is present frontwards in the dorsal area. Okay, it is present in the intraperitoneal region. Okay, anyways, that is not important for us. See, the large intestine is having 6 parts. In that, first part is cecum, second part is ascending colon, third part is transverse colon, and fourth part is descending colon. And here we have sigmoid colon. Okay, this till here, this is sigmoid colon bolte हैं. And this is rectum, and rectum is leading to anus. So how many parts of colon we have 6 parts. Number 1, cecum. Number 2, ascending colon. Number 3, transverse colon. Number 4, descending colon. Number 5, sigmoid colon. Number 6 is rectum. This is 6, rectum. And rectum is finally leading to anal canal or anus. So anus will not come under colon, but it is the ending part of colon. So all these regions are all this large intestine is colon. Clear everybody? So if cancer occurs in this rectum, here in this region, here it is rectum. If cancer occurs in rectum or in any of these colon, that type of cancers are called colorectal cancers. And one very, very, very important point, always remember, cancer, particularly in the GI tract, starting from the abdominal cavity, pharynx, esophagus, stomach, duodenum, small intestine, and large intestine, in all these areas, particularly colon and rectum, particularly this colon and rectum are large intestine, simple. This colon and rectum are having higher probability or higher risk of causing cancer. We don't get cancer in the stomach, in the small intestine, or in the esophagus. वहां पे भी हो सकता है, cancer can be seen in stomach and in small intestines also, but the major prevalence and major risk of getting cancer in GI tract is particularly colon and rectum. Okay, colon and rectum is the region where patients will get cancer in higher proportion. This is very important point you have to remember. Okay, so these are some anatomical parts, morphological and anatomical features of colon and rectum. And we already know, if we see the transverse section of colon and rectum and all, in most of the GI tract, in everywhere, if you cut the GI tract, and in TS if you see, Usually we have four layers of colon. Colon has four layers. The innermost layer is mucosa. This is mucosal layer, and next layer is submucosal layer, and behind that we have circular muscles or muscular layer, and finally we have serosal layer. So we have four layers of four layers in the colon. In colon, if we cut and see, we will find the four major layers. And the importance of layers, slowly I'll try to tell you. I think you all understood the anatomy, what is colon, what is rectum. Okay, four layers of colon. Okay, so these are basic things. Now you see, in today's class what we'll try to learn is we'll try to see the epidemiology of colorectal cancer. In short, number one, we will try to learn the risk factors of colorectal cancer. These are very, very important, most important for the clinical pharmacist. Okay, and number three, we will try to learn about some protectants. In GI tract, if patient is having risk of colorectal cancer, in that, if you know the protectants can protect the patient from getting colorectal cancer. So I'll try to tell you some protectants, their roles and responsibilities and all. And next we'll try to see the pathogenesis. In pathogenesis we have so many mechanisms, but majorly we have two mechanisms. In that, first mechanism is APC beta catenin pathway. Very, very famous pathway. If you understand this pathway, is more than enough. Okay, APC, actually APC is, it is a gene that which produces APC protein, and that APC protein is important in degradation of beta catenin. I'll explain this pathway in detail. And second very important pathway in producing colorectal cancer is microsatellite instability pathway. Actually, all these things are not necessary for a clinical pharmacist, but if you are opting for writing foreign exams or any competitive exams, all these are very, very important. Okay. Anyway, see. So we will begin with the epidemiology. So all these things till pathophysiology we will try to cover in today's class. Because see, oncology, first important point in epidemiology in colorectal cancer. First thing, if you see the gender wise, in gender wise, always remember males are more prone to colorectal cancer, and the ratio of male to female is always 2:1. Okay, in every two males, one female will be affecting with colorectal cancer. That means males are having higher risk of causing colorectal cancer. First important point. Can anyone tell me the reason why males are more affected with colorectal cancer? Anybody from the class? Anybody from the class? Just can anyone guess why males are affected more for colorectal cancer? Why males are affected more in colorectal cancer? In previous classes, in initial classes, I think in first or second class, I don't remember, I told the importance or the epidemiology of cancer in males and females. In males and females, what I told, in males particularly, most common cancer is prostate cancer. Did I tell? Prostate cancer is the first common cancer seen in males, and second most common cancer in males is lung cancer, and third most is colorectal cancer. And in females, the first most common cause is, in females, what I told? In females, what I told? Breast cancer. This is the prevalence. I'm talking about prevalence. And second most common cause in females is again lung, same like females, same like males. And the third most common is again colorectal cancer. Okay, in males, the most common cause of cancer is prostate, second common cause is lung, and third is colorectal. In females, most common cause of cancer is breast cancer. Okay, most common cancer is breast cancer, and lung, and same like males. And the death of cancer, I told another point, the death of cancer is very, very common in both males and females is lung. Among the mortality in both males and females, lung cancer is killing the patients. Okay, anyways, chalo. So colorectal cancer is the second point in epidemiology. Colorectal cancer is the third most common cancer third most common cancer in all the cancers, which is seen in both males and females. Clear? This is another very, very important point. Now, if you see the geographical area of colorectal cancer, particularly in some studies, what they are telling, patients from North America and patients from North Europe. I don't know why only northern areas patients are affected with colorectal cancer. North American people and North European people are mainly associated with colorectal cancer, and the remaining all South America and Asian populations, all other patients are having less risk of colorectal cancer. Okay, this is important. Another point about epidemiology of colorectal cancer. Now, let us discuss some another points about colorectal cancer. Now we'll try to discuss about the etiology and risk factors. Very, very important. This from here you have to concentrate. uh, okay, first important etiology and risk factor for colorectal cancer. Colorectal cancer is nothing but the cancer of large intestine. Don't forget this. Colorectal cancer is nothing but cancer of large intestine. Okay, particularly they are associating with the colon and rectum, that's why they are called colorectal cancer. Anyways, we have already discussed what is different areas of colon and where rectum is located and all. Okay, now you see, in etiology and in risk factors, the main important risk factor is diet. Dietary habit can cause colorectal cancer. What type of food items or what type of diet will cause colorectal cancer? Can anyone give me the answer? Just you can guess. Okay, let me tell you. See, first important main dietary item that causes colorectal cancer is rich fatty diet. Fatty diet. See, why rich fatty diet? If you consume or if we consume rich diet which is containing excess fat, this fat, what it does, this fat, actually all the fatty substances and all will try to accumulate in our body, right? They'll try to accumulate in the adipose tissue, and most of the fats in our body, they accumulates in liver. Do you know this point? Most of the fats in our body, they accumulates in the liver, and when liver tries to accumulate all these fats, sometimes due to the metabolism of fat in the liver, the waste products which are produced from the liver, they are stored in the gallbladder somewhere here in the gall, and this from this gallbladder, the metabolic waste products of fat, they will be secreted into the duodenum. They will be secreted into the duodenum, and from the duodenum, this fat metabolites are entering into the small intestine, and from there it is entering into large intestine through cecum. And in the large intestine, the metabolites of fat are, they are carcinogenic. Due to the carcinogenic ability of these fat metabolites, they will cause risk of cancer in the colorectal region. Okay, why they are not causing in small intestine? Because in small intestine, those substances are not actually metabolized. Because see, most of the fat substances are they are situated, or they are in contact in long period of time, especially in large intestine only, not in small intestine. In small intestine, the movement is very high and rapid absorption takes place. But in large intestine, the time to stay in the intestine is very high in the large intestine. That's why the point of contact, the duration of contact of these metabolic products of fat will stay in large intestine for prolonged period of time. That's why it will cause, especially in the large intestines. That you have to remember. Second, first point, if we consume excess fatty diet, we may develop cancer. These are just risk factors. It is not 100%. 100% those who are taking fatty diet, they will not get, it is not compulsory that they will get cancer, but they are having risk. In future, it may occur or it may not occur, but risk is there. Second important risk factor for causing colorectal cancer is intake of refined carbohydrates. You know what are refined carbohydrates? You know what are refined carbohydrates? All sugars, whatever we take, they are all refined carbohydrates. If you directly consume sugarcane juice, it is not refined. Sugarcane juice is not refined. Jaggery is not refined. Whereas the sugar, we take sugar, no, sugar crystals. Sugar is refined, and excess intake of what we say refined may, what we have, maida. Maida pindi we call in Telugu. Maida is the refined item of the starch. Okay, maida, and what we can say in rice item, in rice particularly the polished rice, particularly polished, especially we in Andhra and in Tamil Nadu and all areas, we take the jasmine rice. Actually, in rice we have basmati rice, jasmine rice, brown rice. So many types of rices are there. Sona masuri rice is there. Okay, Karnool rice is there. So many types of rice items is there. In that particularly the jasmine rice, which is polished one, polished rice. This excess intake of polished rice is always dangerous. All these polished substances, maida, sugar, chocolates, candy, all refined carb, they are called refined carbohydrates. These refined carbohydrates excess intake also can cause colorectal cancer. Why, can anyone tell me why refined carbohydrates will cause colorectal cancer? Any concepts are very very important, that's why I'm focusing. In diet, I already told one point, excess of fat intake can cause colorectal cancer. And second, intake of refined carbohydrates. Refined carbohydrates intake, what it does, these refined carbohydrates, they try to see, when refined carbohydrates are taken, they are not easily absorbed from the GI tract. Remember that, like maida, maida, it will stay in large intestine for a long period of time. And what it does, this maida will try to disturb, not only maida, all refined carbohydrates, they will try to disturb the gastric microflora. We have gastric microbiota, there are so many microorganisms which are useful for our body. They are called gastric microbiota, which will try to metabolize most of the toxins. They will try to metabolize some drugs, and they will help in absorption of vitamins, and they will also produce vitamins. So this gastric microflora is very very important. This gastric microflora, they can also prevent the cancer. Always remember, this gastric microflora, the microorganisms which are present in large intestine, are very very beneficial. They produces vitamin, they help in absorption of vitamin, they detoxify the toxins, and they also prevent cancer. How they prevent cancers, this, when refined carbohydrates are taken, they will stay in the large intestine for a long period of time, and they will disturb the gastric microflora. And with that, due to destruction of gastric microflora or disturbance, this protective effect of cancer is decreased, and it will cause carcinogenic effect, and with that it may cause, or it may lead to colorectal cancer. Simple. Gastric microflora destruction is always dangerous for us. So whenever we are taking antibiotics, always remember, whenever we are taking antibiotics, particularly the antibiotics which are broad spectrum antibiotics. In broad spectrum antibiotics, can anyone give me the examples of broad spectrum antibiotics? Examples of broad spectrum antibiotics. Broad spectrum antibiotics will destroy the gastric microflora. In broad spectrum antibiotics, we have two two types of antibiotics. Can anyone give me the example? Someone was answering. Tetracyclines, not macrolides. Macrolide antibiotics are not broad spectrum. Tetracyclines, doxycycline. Okay, tetracyclines, and second one is chloramphenicol. Tetracycline and chloramphenicol. These both the antibiotics are considered as broad spectrum antibiotics, whereas macrolide antibiotic, we have azithromycin, clarithromycin, all those. We have some other, all other penicillins, cephalosporins, carbapenems, imipenems, all those are narrow spectrums. See, some of them are effective for gram negative, some of them are effective for gram positive, some of them are effective for aerobes, some of them are effective for anaerobes. So, okay, broad spectrum antibiotics are those antibiotics which are very effective for aerobes, anaerobes, gram positive, gram negative, and sometimes they are also effective for some protozoa also. Okay, that's why they are considered as broad spectrum antibiotics. So these broad spectrum antibiotics like tetracyclines and chloramphenicol. In tetracyclines, we have doxycycline, very 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 commonly used drug, and in chloramphenicol is the best example. So both these classes of antibiotics will destroy gastric microflora. So when this gastric microflora is destroyed, again what happens? Vitamin deficiency occurs, vitamin K deficiency occurs. Okay, and it may associate with cancer. All those protective effects of gastric microflora cannot be seen. And gastric microflora also prevents diarrhea. They always maintains the hygiene of GI tract. Large intestine hygiene is maintained by this gastric microflora. So we have to prevent this gastric microflora. And to prevent this gastric microflora, always we have to take what we have to take? Curd. Okay, buttermilk, particularly buttermilk, and excess fiber. Excess fiber is very very important. Excess fiber intake is very very important. Why I'm stressing this, you will come to know in next slides and in next classes. Excess fiber is very very important for our GI tract. They will prevent gastric microflora. They will bulk the they will bulk the formation of feces, and they will increase the gastric motility. Bulk formation, gastric motility, and they will prevent gastric microflora. All these are very very important preventive measures by fibers. So always fiber rich diet, fiber rich diet is very very effective for preventing gastric microflora, and also they will prevent cancer, and also they will prevent diarrhea, and all the beneficiary effects are mainly seen with fibers. And what are the fiber rich diet, why I'm focusing all this? Because I'm a dietitian, that's why I have already done my dieting postgraduate diploma in dietitian, that's why I'm focusing on in all these things. Why? Tell me the sources of fiber. Sources of fiber. Tell me the sources of fiber. Who will tell? All green leafy vegetables, all raw vegetables, fruits, whole fruits and whole vegetables, all what we can say, plant-based diet. Plant-based diet will contain excess fiber. And when we take rice, we have to take unpolished rice. Unpolished rice is always containing a lot of fiber. And when we take fruits, if you are interested to take fruits, always remember, take fruits along with its outer cover, outer cutin and cover, whatever is there. Okay. In Telugu, we have one proverb, పండ్లు తింటే తొక్కతో తినాలి. That means outer, it's chilke rehta na, in Hindi we call it chilke. With chilke we have to take all the fruits. Whole fruits and whole vegetables should be taken. Most of the time what we do, we squeeze the fruits, we take fruit juice, and we will, remaining fibers we will throw. What is the use of taking fruits? Tell me. So whenever you are interested in eating or drinking or in taking fruits, always take whole fruits. You have to take whole fruits. Okay. Remember that point. And in diet, one point what I told, excess fat diet can cause colorectal cancer, excess refined carbohydrates can cause cancer, and decreased fiber diets. Decreased fiber diet can cause colorectal cancer. I think the dietary risk you all understood. Is there any doubt in this? Are you all following me? Next risk factor is, all these risk factors are very very important. See, if you understand all these risk factors, it is not necessary for us to go for chemotherapy, radiation therapy, or any other surgical therapies. Before getting cancer only, we can prevent the patients. घर में counsel करो, you counsel your parents, you counsel your neighbors to take all these dietary risk factors. If you understand all these risk factors, it is very very important. Okay, it is, you can prevent the patients getting from cancers. Next risk factor is elderly population. Okay, patients who are more than 50 years, above 50 years, patient are always, they are at risk of getting colorectal cancer. Can anyone tell me why elder populations will have risk of developing colorectal cancer? I want to listen from you. Can anyone tell me why elder populations will have greater risk of causing colorectal cancer? Because the organ activity decreases. In as age increases, our liver function decreases, our gastric gland activity decreases, our gastric microflora activity decreases. The movement of gastric, the movement, okay, the gastric motility decreases. Patient will develop constipation. All these, directly or indirectly, all these factors, what they cause, they will cause development of colorectal cancer in elderly populations. Nowadays it is not only for elder populations. Nowadays, patient in younger population also they are getting colorectal cancer. Why? Because of bad diet, unhygienic diet habits, and due to familial history, or due to, simply we can say, hereditary. Particularly diet is important. What we eat, what we are. What we eat is what we are. Always remember, colorectal cancer is mainly caused by diet. Colorectal cancer is mainly caused by diet. Okay, you have to remember this. I am focusing and stressing at this point. It's very very important, that's why. Okay, in younger populations also, nowadays patients are getting colorectal cancer. That is because of unhygienic dietary habits. Okay, this is about, age is one risk factor. And next important risk factor is smoking. Smoking patients are having high risk of getting colorectal cancer. Exact reason, exact mechanism is not mentioned anywhere, but patients with colorectal cancer whose history is smoking are affected. Okay, so they concluded that patients with smoking can also lead to colorectal cancer. Exact mechanism nahi hai, but Smoking can cause colorectal cancer. And one more risk factor is history of polyps. History of polyps. This polyps is very, very important concept. I'll try to explain about the polyps, who will develop polyps and what are polyps and what are GI related, colon related polyps and all. I'll try to explain this. If patient has history of polyps, so they are also having risk of getting colorectal cancer. And next risk factor is familial history or family history or hereditary. Or if parents are affected with colorectal cancer, definitely their children, if they cross 30 or 35, they also may develop cancer. Okay, colorectal cancer particularly. If grandparents are having colorectal cancer, their children, their children can develop or our parents can develop. अगर अपने grandparents को colorectal cancer है, तो अपने parents को भी होने के chances है. If our grandparents are affected with colorectal cancer, our parents also can risk is there. It can cause cancer. And if our parents are having cancer, definitely we are having high risk of getting cancer. Okay, colorectal cancer. That you have to remember. And one more very, very important risk, very, very important risk factor of causing colorectal cancer is excess intake of red meat. Excess intake of red meat or any other meat items. Because meat is very, very important dietary factor which is not having fiber. So fiber-less diet. Always remember, जो भी fiber-less diet है, whatever fiber-less diet you are taking, they are having risk of causing cancer. Okay, carcinogenesis chances are very, very high. So excess intake of red meat or any kind of meats, any kind of meat is always, it is risk. So whenever patient takes meat or anything, always remember to take excess fiber. Excess fiber. You have to remember this point. Okay, so these are some risk factors, and along with that, some other syndromes we have. In those syndromes, while explaining about the causes, while explaining about the pathological pathophysiology, I'll try to explain these syndromes. So these are different risk factors of causing colorectal cancer. I think you all understood. In risk factors, what we have seen, in risk factors, diet is very important. Elder population is very important. In diet, I told 3 points. One is excess fat and taking refined carbohydrate and taking diet with less fiber. Okay, less fiber diet. And in elderly populations, patients above 50 or 60 years, they are having another risk of getting colorectal cancer. And smoking, history of polyps, okay, and family history, hereditary, okay, and some syndromes. All these are different risk factors of causing colorectal cancer. Okay, now I was telling you about colorectal polyps. If anybody has history of polyps, they may develop carcinogenesis or they may develop carcinoma. Okay, always remember, polyps are, they are the growths in the GI tract. Okay, especially in the large intestine, there are, these are growths, excess growths. Okay, or mass production or uh, unstoppable or excess proliferation of epithelial cells. Epithelial cells excess growth. Actually, all the polyps are benign. All the polyps are benign tumors. They are benign tumors. And if patient has benign tumors like polyps, definitely they may cause malignancy. Okay, they may cause carcinogenesis. And in previous classes, I told the cancer which is associated with epithelial cells, the cancers which is associated with epithelial origin are called, what they are called, cancers which is associated with epithelium are called, did you remember or not? Papilloma, did I tell? Papilloma is the term which is given for the cancer which is associated with benign epithelial cells. And if epithelial cells which causes malignant or malignant tumors, they are called carcinoma or adenoma. Carcinoma or adenoma. Carcinoma in the epithelial cells or tumor in the epithelial cells are called carcinoma. Papilloma is benign excess development of epithelial cells. Papilloma is the benign excess epithelial cell development, and carcinoma is excess epithelial cell development which is originating from one place to another place. Okay, they are malignant. They are called carcinoma or adenoma. Adenoma are particularly if there are glands here in GHC, total GI tract is having glands, right? If the glandular cells are having carcinoma, if glandular cells are producing excess proliferation, and if they are causing tumor, they are called adenoma. Adenoma is the term which is used for glandular cells. And epithelial cells, papilloma or carcinoma. Papilloma is benign, carcinoma is malignant. Okay, so colorectal polyps. In colorectal polyps, actually, we have so many types. These are polyps are excessive growths or benign growths, papilloma in the colon region. They are called colorectal polyps or colon polyps. Okay, some of them are having without stalk. They are attached, or they are attached on the inner layer of the lumen of the large intestine, and few are having a stalk. Okay, yes, a morphology. It's not necessary for us to remember. Okay, now you see, according to the morphology of polyp, according to their morphology and according to their size and according to their features, mainly these polyps are three types. In that first type, you can see tree-like structure. Tree-like structure. In that we have tubular. These are called tubular adenoma. Tubular adenoma or one. This is one first type of polyps. These are benign. Always remember, these are benign tumors or benign polyps. Benign polyps. Polyps are not cancers. Remember, polyps are not cancers. If patient is having history of polyp, that may develop carcinoma, that may develop cancer, that may develop colorectal cancer. And these polyps are not cancer. Always remember. Okay, so in polyps we have three major types based on their morphology. First one is tubular adenoma. Second one is villus. These are villus type. Okay, we you can see villus type. And third one is tubulovillus. Both features can be seen in the third one. Tubulovillus, tubular as well as villus, both the features were seen. Now you see the tubular adenoma, particularly, these are very, very and most common types of polyps. Most common type of polyp is, this is most common. Tubular adenoma or tubular polyps are very, very common. And here this villus type and tubulovillus type are less common. Both of them are less common. If these are 80%, 20% will be seen villus adenoma and 10% will be villus adenoma, and remaining 10% will be tubulous adenoma, tubulovillus adenoma. Okay, the most common type of polyps that can be seen in GI tract are tubular adenomas. Now, what features are available for this? What features? How to remember their clinical features and all? You see, always these tubular adenomas are asymptomatic. They are not having any symptoms. Sometimes, if this tubular adenoma is removed from the GI tract, if it is detached, if this is detached, see from here, if it is detached, this is a tubular adenoma only. If it is detached, what will happen? It will cause bleeding. So sometimes this these tubular adenomas are associated with bleeding, bleeding in GI tract. So first, most of the time, tubular adenomas are asymptomatic. Sometimes they are presented with bleeding, and their morphology is seen like this. Okay, tubular. That's why they are called tubular adenomas. And second type is villus. These are less common, and particularly if you see this villus type of adenomas are seen particularly in distal colon, and sometimes in rectum also. And this tubulovillus can be seen anywhere in the uh, large intestine, in the colon, and they are very less common. That already we know. Clear? So they are having both the features of tubular adenoma and villus adenoma. So these are types of polyps. Now you understood what are polyps. Polyps are not cancers. They are just benign excess growth in the colon. And if this is continued, this benign may cause malignancy, or they may cause cancer. So in risk factors, I told one point. If patient is having history of polyps, they may cause carcinoma. Okay, they may cause colorectal cancer. Remember this point. That's why I'm telling you about polyps. Now you see, I would like to tell another important points. Like I told, colorectal protectants. Colorectal protectants. What are colorectal protectants? Just now I told, these are the protectants which will try to protect the colorectal area from causing carcinogenesis. Okay, so in that, this is very, very important. If you can understand this, you can counsel the patient who are at risk, colorectal cancer risk patients. These are very, very important. Okay, first important protectant for GI tract is excess fiber diet. Excess fiber diet. Excess fiber diets, like we have vegetables, veggies, all types of veggies. Particularly in India, Most of Indian populations, they don't take veggies, raw veggies, they will not take. Always veggies is cooked. And one more point, when veggies are cooked, when vegetables are cooked, vitamins, most of the vitamins are damaged. Do you know this point? The vegetables, after cooking, all the vitamins which are available, the nutrition which is available, they are degraded. Most of the B vitamins, vitamin C, vitamin A, all these vitamins are heat sensitive. Do you know this point? So when vegetables are cooked, most of the protective actions of these vegetables are degraded. So cooked items are less consumed. And here excess fiber diet means, always remember, the raw vegetables. And in India, particularly, if you see, in India only, people will consume carrot, beetroot, beetroot, and some cucumber family vegetables. Like we have what we have uh, cucumbers. In cucumbers, we have, in Hindi we call it kakdi and kheera. We call those. Okay, so these substances like cucumberaceae family, all the substances, these are particularly consumed. And in few cases, we have cauliflower and cabbage, okay, spinach. They are also taken directly raw, but in India they don't. They usually cook. And in raw substances, we can take these carrot, beetroot, and cucumbers. So these are very, very important gastric protectants. Always remember, excess fiber diet, which is containing this carrot, beetroot, and all these are very, very important protectants. Here you can take tomato also, tomato and all other fruits, all the fruits, whole fruits, they are protectants. I think you all understood the first protectant. Now, next, colorectal protectants. Colorectal protectants, particularly antioxidants. Antioxidants. You know, most of the cancers are caused due to oxidants or free radicals. What free radicals does, free oxygen radicals, they will go and they will cause mutation in the genes, and with that they will cause carcinogenesis. They will simply cause cancer. Okay, and here in the mutations, particularly, we have tumor suppressor genes and we have oncogenes or proto-oncogenes. If mutation occurs in the tumor suppressor gene or in the proto-oncogenes, what will happen? Tumor suppressor gene activity decreases, and with that, the cancer activity of proto-oncogene increases, and with that, cancer will be developed. So free radicals are very, very dangerous. So to neutralize these free radicals, or to neutralize these oxidants, we have antioxidants. And in antioxidants, always remember, most vitamins, particularly the strongest antioxidant and excellent vitamin with antioxidant property. Can anyone give me the example of excellent antioxidant property? Anybody from the class? Excellent antioxidant property having vitamin, which is vitamin C. Very good, vitamin C. Vitamin C, excess intake of vitamin C is always beneficiary in GI tract, particularly in colorectal cancer, who are having risk of developing cancer. So if patient is taking in diet, I told few diet, like if you are having excess fatty diet, जिस दिन fatty diet ले लिया, if you have taken excess fatty diet, at that, on that day, you take 2 to 3 lemon juices, 2 to 3 lemon juice, squeeze it and you drink. Along with that, you can have some carrots, some beetroots. Okay, so always remember, what you eat is what you are. Always you have to balance your diet. Okay, so antioxidants in that, vitamin C is very important. And along with that, there is one component called selenium is one metal. Actually, it is a element. This selenium containing vegetables, particularly, these are also very, very important. Selenium is also one element which is having natural antioxidant property. The only element which has antioxidant property is selenium. One important point for uh, competitive exams. Selenium rich containing vegetables and fruits. I don't remember the selenium rich containing vegetables, but if selenium is available, selenium is the natural antioxidant. Element having antioxidant property is selenium. Okay, that you have to remember. And vitamin A, another very, very important protectant is vitamin A. Vitamin A rich sources, what we have? We have egg, we have carrots, all vegetables, deep colored vegetables. Okay, and fish oil, and few meat also, meat. All these will contain vitamin A. Okay, so vitamin A is also another antioxidant. It has antioxidant property, and also it has cancer protecting activity. Particularly vitamin C and vitamin A are very, very important. Okay, vitamin C is water soluble vitamin, whereas vitamin A is fat soluble vitamin. Vitamin C is daily taken, vitamin A is not daily taken, because vitamin C will excrete from the body immediately, whereas vitamin A, if you have taken vitamin A today, it will stay in the body for prolonged period of time. That's why everyday intake of vitamin A is not necessary. Vitamin A toxicity can be seen, but vitamin C toxicity is not seen, because vitamin C is water soluble and it is easily excreted unchanged from the kidneys, from the urine. Okay, remember this point. Okay, you already know fat soluble vitamins and water soluble vitamins, all A, D, E, K. A, D, E, K. These four vitamins are fat soluble. Always remember A, D, E, K vitamins. These vitamins are not taken every day. They are not necessary. Once in a week, once in a month, if you take, that is enough. And most of the time, this A, D, E, K enzyme vitamins are stored in the liver, and our large intestine microbiota will produce all this. Whereas vitamin C and vitamin B, okay, they are water soluble and they are excreted from the body rapidly. That's why vitamin B and vitamin C is taken every day. That is important. Another important point. These are colorectal protectants that you have to remember. Clear? Now, yeah. Now we'll, yeah, in previous classes I was explaining you, we have some tumor suppressor genes and we have oncogenes, right? Tumor suppressor genes are those genes which will suppress the tumor production, and with that they will protect the body from developing tumors, right? So if patient has mutation in this tumor suppressor gene, and in that cases, if tumor suppressor gene is decreased in the body, if their activity is decreased in the body, definitely they will cause cancer. So particularly for colon cancers, which tumor suppressor gene is responsible is always remember here. Yes, in tumor suppressor genes, particularly that which causes colon cancer, what where we have colon cancer, colorectal cancer here, all these tumor suppressor genes. Okay, these will cause colorectal cancer. I was making mistake. Why you people are not responding? See, I was talking about oncogenes, and see oncogene. I was here. It is mentioned as oncogene, and I am explaining about tumor suppressor gene. You are not responding. I think everybody are sleeping. Are you all sleeping? You have interest or not? You have interest or not? Bolo. All these important concepts we have. APC mutation, beta catenin mechanism. I'll try to tell you this mechanism because this mechanism is very, very important in pathogenesis. So now let's talk about how cancer is developed. How cancer is developed in colon. Okay, cancer means particularly here we have adenoma, or it may be adenoma or it may be carcinoma. Both adenoma and carcinoma are both cancers only. Adenoma means the cancer which is associated from the gland cells or from the glands, and carcinoma is particularly for epithelial cells. Epithelial cells. These are malignant cancers. Cancer in colon. So in colon, it may be adenoma or it may be carcinoma, and simply we are telling it as colorectal cancer. Okay. Anyways, so in production of colorectal cancer or in pathogenesis of colorectal cancer, see we have two main mechanisms. Just now I told we have two main mechanisms. In that first mechanism is APC gene mutation or B catenin protein overactivation. So that is called APC beta catenin mechanism. APC beta catenin mechanism. This is first mechanism. And second very, very important mechanism is microsatellite. Microsatellite. All these are very, very important. Microsatellite instability pathway. Okay, so these two are very, very important pathways through which patient develops colon cancer. Now I will try to explain you about APC mutation. Okay, see, actually APC gene is a tumor suppressor gene. Okay, APC gene, here it is, tumor suppressor gene, where it is. See, APC gene, what this gene does, this APC gene is a tumor suppressor gene. If this gene has mutation, So what happens? The protective activity or tumor suppressor activity of this gene will stop. Now I'll try to explain you. See. In the mechanism of APC mutation, in pathogenesis, we have two main mechanisms. In that, first mechanism is APC gene mutation or beta catenin pathway, right? This is the first mechanism. In this, see, we have, I'll try to tell you the main risk, how this pathogenesis occurs. In that first one, it has different pathways. In this pathway, it has different steps. In that first one, what happens? The APC, this APC, it is a adenomatous polyposis coli. Adenomatous polyposis coli gene, APC gene, it produces certain proteins which will protect the GI tract, especially colon. If this APC gene is mutated, so what will happen? APC proteins are not produced, and with that, the tumor suppressor activity decreases, and it will cause carcinogenesis. First, APC gene mutation is first step or first method. Okay, and second, there is point mutation in KRAS gene. KRAS gene. What is KRAS gene? Here again, we have to go back for the list. KRAS gene. What is where KRAS gene is located? KRAS, NRAS. I told no. These are oncogenes. Overproduction of KRAS gene. Okay, point mutation occurs in the KRAS gene. Point mutation occurs in the KRAS gene, and with this KRAS gene, it is a proto-onco. It is an oncogene. Oncogene. This oncogene, what it does? It will cause production of excess proliferation in the epithelial cells of GI tract, and with that it causes colorectal cancer. Okay, this is second method or second mechanism. Third, all this will come under this APC beta catenin pathway only. Third, deletion of DCC gene. Okay, again DCC gene is also important in protecting or in causing colorectal cancer. Even that will again, it will cause, this deletion of DCC gene will cause colorectal cancer. And fourth important mechanism, very very important mechanism, is loss of TP53 gene. What is TP53? What is TP53? What is P53 or TP53? क्या है? What is TP53 gene? Yes, are you all following me? TP53 is the tumor. Very good. It is a guardian of genome, or it is a tumor suppressor gene. Tumor suppressor gene. This tumor suppressor gene is not only suppressing the carcinogenesis in colon. It is not only suppressing the carcinogenesis in colon, but this TP53 tumor suppressor gene activity is present in most of the tissues in our body. That's why this TP53 gene is called guardian of genome. This point already I told in initial classes. So if the loss of TP53 gene activity is decreased, what will happen? It will cause not only colorectal cancer but also other cancers. In all other cancers, colorectal cancer is one type of cancer. Okay, so TP53 gene loss of this activity can cause colorectal cancer. Okay, so these are four different steps or different mechanisms in APC gene beta catenin pathway. Now you see actually what happens. Why beta catenin pathway? Name it as beta catenin pathway. Is, see, actually there is a very very important protein in the cell. Each cell, see, every cell is having DNA in its nucleus. DNA undergoes transcription and forms RNA. Transcription and forms RNA, and this RNA undergoes translation and forms proteins. Right, proteins. In this process, some cells, what they do, they will produce one type of protein which is called beta catenin. Beta catenins are important proteins in each and every cell. Okay, these are special proteins. This beta catenin proteins, what they do, it has very very important role in cell division or cell proliferation. This beta catenin has role in cell division. Once this beta catenin divides the cell, once mitosis occurs, this beta catenin will degrade. Let me repeat, beta catenin is important in cell division. Once the cell division occurs, the beta catenin is degraded, and this degradation is caused by APC protein. APC protein is coming from APC gene. APC gene is tumor suppressor gene. Okay, this tumor suppressor gene, it is producing APC protein. This APC protein comes, and what this APC does, APC protein does, it will degrade the beta catenin. Once the beta catenin activity is done, immediately the beta catenin will be degraded by APC. If APC gene is mutated and if APC protein is not produced, what will happen? Beta catenin is not degraded and beta catenin activity keeps on increasing and patient cells will keep on proliferating. Yes or no? And with that, it will cause cancer. Same, simple. That this type of mechanism is called APC gene beta catenin pathway. I think everybody understood this pathway. Clear? Now let's talk about microsatellite instability pathway. Microsatellite. टाइम क्या बज रहा है? तो टाइम तो बहुत हो गया ना. We will continue these pathways and clinical presentations and all in next classes. Okay.